Hello friends, welcome to Medicine 101. Today we'll talk about the rheumatic heart disease. So before understanding the rheumatic heart disease, let's have a concept of the rheumatic fevers. So what is rheumatic fever? Rheumatic fever is basically we can see in case of the pediatric from 5 to 15 years old. Now rheumatic fever that is caused by on top of the bacteria that is very familiar. So the name of the bacteria that is the beta hemolyticus streptococcal group Lansfield group A. So beta hemolyticus streptococcal Lansfield group A. Now this type of the bacteria, okay. Now for how this disease will get progressed, that's the thing here. Now let's suppose one parent has come to you, the PD. Now he is saying that he's complaining about the sore throat of his children, okay. Now let's suppose a sore throat. Now whenever the sore throat will be here, okay. Now the definitely whenever this bacteria is there, so bacteria will have the different types of the structures, different types of the antigens on the surface protein will be here. Now let's suppose if you consider the bacterial structures, now within these structures we'll see the different types of the antigen. Let's suppose within this here I'm just considering this is like the NAG. There's the N-acetyl glucosamine. I'm repeating once, N-acetyl glucosamines, or we can see the like the structures like the M protein. Okay, this type of the structures we'll see. Now whenever this NAG or M protein type of the antigens will be over here, these are the foreign antigens or the foreign particles you can consider here. As a result we see there will be what the activations of the immune systems. As a result we see the complement that will come over here. Antibodies first will come over here. Okay. And whenever these antibodies will be here, this will activate, this Fc regions will activate the complementary systems. There are the different types of the complementary proteins from the C5b, if you consider C9. I am not going in details about the complementary systems. I am having a different video on it. Just you can just watch it if you want to have a clear idea about it. So that will form the MAC, or we can say the membrane attack complex, that will produce the different types of the pores, bacterial holes. As a result, the bacteria, there will be some osmotic changes within the bacteria and the bacteria will get die. Okay. Now these antibodies will come over here, they will react it. Okay. That will be the normal thing here. Okay. Now for example, this baby is getting suffered for like the frequently the recurrent infections. Okay. Now let me tell you this thing, that these types of the antigens are also present within the antigen. If we say structures of the antigens within the antigen, there are certain types of the epitope we can see where the antibodies get bind, like so is the epitope of the antigens. Now same types of the epitope or antigenic epitope that is present over here in case of the streptococcal beta hemolyticus. Same types of the antigens are also present, or epitopic antigens are having in the different tissue organs. Okay, if we just talk about, as we are talking about right now, the rheumatic heart disease. So if you see the structures within the endocardium, let's suppose the endocardium, within the endocardium, if we see there will be also some types of the antigens, especially in the valvular structures. Here, within the valve, like the leaflets, we can consider over here. That is just like the laminin. We can just name it laminin. So laminin is also having the same type of the epitope that is similar, that is having the similarities with the antigenic epitope, like the NAG or M protein. Okay. Now, before going to that, let's suppose there is chances for these antigens to go through the circulations. Okay, whenever the recurrent infections will be here. Okay, there is a chances for the babies. Okay, through the circulation of them, these antigens can go through the where the different tissue origins. Okay. Now, what's the main problem over here? That as we know that whenever this antibodies will be produced here, as we know that this laminin, the laminin structures or the different types of the antigens are present over here, that is having the similar types of the antigens over here. Now our immune systems will not be able sometimes to they can't differentiate that whether it is like self antigens, because this antigen is also having the similarities with the streptococcal beta hemolyticus Lansfield group antigens. Now as a result we will see these antigens, whatever the valvular antigens are present here, our immune system sometimes that mismatch and that can attack over here, antibodies. Okay, before going to that, let's have a normal structures of the heart. We know there's the innermost structure, there's the endocardium, there's the myocardium, the muscular layer. Outermost structure, there is the pericardium. So whenever the antibody will be produced against the what? These bacterial antigens, okay, this antibody can go over there. Okay. Now, before that, let's talk about the valvular structures. If we talk about the valvular structures, see, there's the valve. These two regions is known as the valvular cassets, or you can see the leaflets regions. Now, if you want to show more clearly, let's suppose the valvular structures I'm showing you here. Okay. Now, whatever the thing will get over here. Okay, just like this. Now, this space, this is known as anterior leaflet. This region is known as posterior leaflet. Okay, there are two leaflets in case I'm talking about the mitral valve. Okay, for examples, and in between the leaflets you see there is a gap space that is known as the commissure. Okay, as this type of the antigen or the same types of the antigens, so which are having the similarities to the bacterial antigens that is present in the endocardium, so the most chances for the endocardium to get affected here. Okay, the most chances for the endocardium to get affected here, because same types of antigens are produced here. So as a result, if we see the structure, valvular structures, if we see more specifically that within the valvular regions, the more types of the antigens are present over here. Okay, let's suppose the antigens are here. Okay, let me show with another color. Within these structures, let's suppose the antigens are here. Whenever the antigens are here, okay, whenever the antigens will come over here, for examples, so definitely the autoreactive antibodies, they will come over here. The autoreactive antibodies, they will come over here, no doubt about it. Okay. Similarly, these antibodies then can come through these circulations, through this space also in the backward. Okay. Now, whatever the thing will see, whenever this antibody will just attack the antigens, okay, self antigens. So we can say the first whatever the thing will shift into the sequences over here, we get the autoreactive antibodies. So we are getting the autoreactive antibodies. These autoreactive antibodies will be produced against the self antigens. Okay. Now, whenever this, this type of the reactions will see over here, then whatever the changes we will see further. Okay. Now, if we just see these structures, I'm just showing this structure because the same type of the thing will see also over here. I'm showing the valvular structure because the most vulnerable place for this type of the disease is the valvular structures. Okay. Now we know that different types of the antibodies, they will come over here. Different types of the antibodies will come over here, and whatever the changes we will see, I'm just showing in this region. So whatever the regions of the endothelial cells. Now whenever we just talk about the endothelial cells, I'm just making it marking with the red color. Okay. Now these endothelial cells, that will be also injured. Okay. Now they will ask for the helping. Okay. Whatever problem we see over here, that these endothelial cells will ask for the help. Now, whenever, let's suppose I'm just enlarging the endothelial cellular regions over here, that let's suppose the endothelial cellular layers over here, I'm just enlarging this part here. Okay. Now they will express some adhere molecule. Over here. Okay. And whatever the adhere molecule, that will just signals that will produce some type of the chemical signal that can act as the BCAM on. Okay, whenever the BCAM on will be here, then in between there will one type of the chemical signals or produce the production of one type of the chemical signals that can activate or that can attract whatever the things. So first I said autoreactive antibodies, then the endothelial cell injury, and they can express on top of the adhere molecule where you can see that BCAM on that will get attached, and that can activate ultimately the CD4 positive T cells. Now the CD4 positive T cells will come over here. So we see the structure over here. First, the antibodies or autoreactive antibodies over here. Okay. Then we got the BCAM 1. Then we got the CD4 positive T cell. We get the T cells. Now if I see the structures, the normal cellular structures of the endothelium. Now at first we will get the the BCAM we got over here. Then we got the CD4 positive T cell we got over here. Okay. Then after that, what are these CD4 positive T cells, they can attract more amount of the inflammatory cells. Actually, they will produce the different types of the cytokines. By the productions of the cytokines, they can activate the inflammatory cells, more amount of the inflammatory cells. Okay, the inflammatory cells is just like you can say in terms of the monocytes that after the circulation, whenever they will be out of the circulation, they will be known as macrophage. I am writing the ultimate term. You will see the macrophage will come over here, the neutrophil. Okay, they will come over here. Okay, and one of the important thing over here, whenever the this macrophage will come over here. Let's suppose the macrophage has come over here. Now, whatever changes we see, normally what do we know? That within the cell, let's suppose if you consider in the cell, within the cell the nucleus is like this, it's around here, condensed, okay? But in this cases, this macrophage will have the nucleus just like this, okay? Just similar like the structure. That is known as the caterpillar cell over here. This is the caterpillar cell. Okay. Now, what did we know up to this much? That this part, whenever these inflammatory cells will come over here, they will secrete the different types of the destructive enzymes. So they will secrete the different types of the destructive enzymes. As a result, whatever the thing will see, there will be ultimately what inflammation of the valve. As I am just right now talking about the valvular structure over here. So there will be the valvulitis. There will be the valvulitis. Okay. And as we know, that is the normal thing that this, let me just recap once again. The antigens came over here. Whenever the antigens, antigens come not like just like this. The antigens are having the similarities over like the streptococcal antigens. So the antigens are fixed over here. Let's suppose if I say just like this antigens, okay, the self antigens that is having the similarities with the streptococcal antigens as per the epitope is concerned. So you see antigens are fixed. Now the antibodies will come over by the circulations and they will get distributed over here. So antigens are fixed, antibodies are coming over here. So this type of the reactions, the type 2 hypersensitivity reaction. The type 2 hypersensitivity reactions will see over here. Anyway, let's come back over here. Okay. Now whenever we see the valvulitis or the inflammations of the valve, definitely whatever the changes we will see in these regions, this valve that will get swollen. It will get swollen. Edematous and it will get swollen. Now whatever the more problem will be over here, now try to understand that whenever the heart will contract, whenever the ventricle will contract, at each time of the contraction or in systole, if we see or relaxation, this valve reflects. Okay, just like this if we consider. Okay, let me show with my hand. Just like this. Okay, it will contract, it will relax, it will over the leaflets that whatever you are seeing the commissure that will be closed, relaxing, again it will contract like this. During the contraction it will get opened. Okay, just like these things. So nothing like this. These two of my hands are getting inflamed. Now just I'm just clapping. Whatever the changes will be here. Now the more problem will be here, the painful what? These two hands already injured or inflamed. Now if I just do the clapping just like this, now whatever the problem will see, it will be more severe. The inflammation that will be more severe as a result. Will see the much more complications will be found over there. Okay. Now if you see the structure the same way, that whenever these two edematous valve leaflets, they will just hit each other during the systole and diastole, what type of the changes we will see over here. That there are endothelial cells over here in these regions, they will on top of the ulcerations. Why? Whenever they are just hitting each other, as a result we can see rubbing or ulceration. So ultimately we can see in this structure we will see just like this ulcerations. Okay, this is the ulcerations. Now whenever this will be ulcerated, as a result we will see the main problem will be over here, that the endothelial cells, okay, they will lose their property, whatever the property they have. If we see under normal circumstances, the circulatory endothelial cells, okay, this is the endothelial cells. Now through it the blood is passing. Okay. Now normally what do we know, that whatever the platelets are coming over here, they are not having the ability to get stuck over the what? Endothelium. Why? Because there are some chemical molecules that will not let the platelets to get stuck over here. But whenever the endothelial cells are injured due to the valvular leaflets, what? Patients we can see here. Okay. Or hitting of each other of the valvular leaflets structures. So we can see this, the endothelial cells of these regions will lose this property. As a result, we will see these platelets can stuck over here. Along with the platelets, we will see the different types of the proteins, we can see the fibrin molecules that can also stick over here. So we'll see the depositions of the fibrin molecules along with the platelets. Now this type of the structures, whenever we will see, this is known as the vegetations. This is known as the vegetations. Okay. Now see, just see it once. Let me make it more clear for you guys. Now whatever the changes we will see, there will be presence of the vegetations. The vegetations for these structures, for the endothelial cells injuries. We see the different types, vegetations. Vegetation especially we can see in terms of the whenever the platelets along with the fibrinogens will get stuck over here, they will produce the vegetations, and these vegetations will be along the line of these structures. Okay. So basically, if we see, okay, within these structures, these vegetations will be over here along the line of the leaflets first. Along the line of the leaflets first. So there will be the immune complex reactions. Okay. Now just try to understand that whenever the vegetations will be just like this, the vegetations can be also with the immune complex that can attack also the immune systems or the self antibodies that can attack also these regions. What is this region? The fibrous annulus, or you can say annulus structure. These are the cusps and leaflets also we can talk about here. The anterior leaflet and the posterior leaflet that can be also affected over here. Okay, in these regions. Then whatever the changes we will see, then now let me tell a physiological link over here before going to in details. Now let's suppose this ventricle is trying to secure or it is contracting. As a result, what we'll see, the blood, whatever the blood is present within this region, that will be sent up. Okay, whatever the during the its systole. Okay, this valve will get closed automatically. As a processes of normal things, it's very clear. This blood will be sent to these regions. That will be pushed. This blood will be pushed in through the aortic valve in the aorta. Now there is chances of the regurgitations, but it will not happen. Why? Because there is another more extra support. Whatever the thing we see in these regions, what is the presence of caudate tendoni. Presence of caudate tendoni. This caudate tendoni also is getting attached with the papillary muscles. If you see, this is the papillary muscles, this will be also attached with the caudate tendoni. As a result, it will not let the blood to go to the atrium in these regions. Okay, so it's the normal structures. If you see the structures over here, now let me show it. That let's suppose it's the caudate tendon over here. Now along with that, the caudate tendon, you will see the papillary muscles over here. Now when the immune complex, whenever the endocardium will be injured, as a result we can see the immune complex that can attack also over here. So this part will be also inflamed. So inflammations of the, we can see the caudate tendon along with the papillary muscles. Okay, you can see also over here. Now let's go back to the main part here. Okay. Now whenever we'll see this type of problem will be here. Okay, we are seeing the inflammations of the valvular structures. We are seeing the inflammations of the caudate tendon. Under normal physiological circumstances, when we see these are the pliable, these are the soft, okay, just normal structures. These are the pliable, so there is no problem. That can contract properly, so it will not let the blood to go to the atrium. So it will just prevent the regurgitations. Okay. Now, whenever these things will be totally inflamed, this is also inflamed. As a result, we will see there is a chances for the blood to go backward from the ventricle to the atrium. So this is known as the what? As we are talking about here, the mitral valve. So as respect to that, we can see the mitral valve regurgitations we can see over here. So let me just erase this part over here. Okay. So whatever the problem we can see for the mitral valve regurgitations. So we'll see the mitral valve regurgitation. Now, whenever this part of the problem we will see, then we can see the different type of the more complications. Whatever the complications we will see over here, that whenever the mitral valve regurgitations will be here, actually the on the abnormal blood flow will see this valvular structures is not working well because it is getting inflamed. Okay, then whenever it will get inflamed, then we'll see further the more complications. Whatever the more complications, at the end of the result we'll see the different types of the fibroblasts there will come over here. Fibrocyte that will get converted into the fibroblast by the different growth factors. They will come over here. Okay, as a result, we will see. I just showed you this structure over here, that this part, whatever you are seeing, this part, where the commissural part, whenever the fibroblast will be here, that will get deposited over these regions, reflex regions. Along with that, we'll see the depositions over here. As a result, the narrowing of the valvular structures of the commissures. So, there will be much more problem of the valve for the blood flow over here. Okay. Whatever the problem we'll see over here, that whenever the blood is coming within the ventricle will try to secrete, as much it can, but as the valvular structure is not working well, so there is a chances for the blood to go back from these regions to the atrium. So this type of thing we already see the mitral regulations. So this on top of the water, the abnormal blood flow we are seeing here, that is known as the murmurs. Now we'll talk about the murmur of the abnormal blood flow you can see over here with respect to the endocarditis. Okay. At first we are talking about the endocarditis over here. Then we'll talk about subsequently myocarditis and pericarditis over here. Okay. So whenever the blood is whenever the blood has come over here, the ventricle is secreting too much, so there is chances for the blood to get, as a result of the mitral dilatations, blood will come over here. Okay, abnormal blood flow. Now this type of the on top of the heart sound we can see over here, that is known as the pansystolic murmur, because along with the whole ventricle, this is during the systole of the whole ventricle, this blood will be pushed, okay, and the blood can go from these regions to the atrium. These regions, backflow. So this is known as the pansystolic murmur. Pansystolic murmur, abnormal abnormal blood flow. Okay. Now this type of sometimes we cannot see it here properly. Maybe for the noise, or maybe some more patients are there. So just to make sure that this type of the murmur is there, we need to do the echo for it. Should go for the echo. Okay, if you can't hear using the stethoscope, so definitely you should go for the echo. Then another type of the murmur you can see over here. Okay, now let's suppose, let me erase this, let me draw more hot here. Then it will be more understandable for you guys. As we know that the valvular structure is also present over here. Myocardium. This is covering this valve, this is also covering this valve. So as we know that whatever the valve is here is the aortic valve. Now whenever this valve will also get inflamed, because there is also presence of those type of the antigens in the endocardium, that is covered by the endocardium as well. The normal structures, the valves are covered by the endocardium. So we'll see that whenever this valve will also inflame, as a result this will be also rheumatized, that will be not able also to stop the backflow of the blood from these regions to these regions. As a result, we can see that the abnormal blood flow from these regions. So from these regions, the abnormal blood flow you can see over here. So whenever, let's suppose, whenever the ventricle is relaxing during the early, what we can say during early diastole. During early diastole, we can see on top of the heart sound. Okay, on top of the abnormal blood flow will be here during the early diastole of the ventricles, and that can produce another type of the sound over here. So this this sound is known as the early diastolic murmur. So at first we got the pansystolic murmur over here. During the second time you can see here over here the early diastolic murmur. Early diastolic murmur. Because this valvular structure is not also working well. Okay. Now another type of the thing we'll see over here. Now if I want to show you over here, let me draw another more thing over here. I'm just drawing it just like this. Okay, I'm not drawing the endocardium here to show it because it will take time. The videos will be longer for it. Now, whenever the ventricle has pumped the blood, it has pushed the blood. This blood will go in these regions, no problem. Okay. So whenever this valvular structure is not functional, okay, as a result, during the mitral regurgitations or whatever I said, you can systolic murmur here. Okay, during that time, there is a chances for the blood to go back, and sometimes we see the blood will be accumulated already here, okay, for the ventricular systole. Okay, now we already know from the lungs the blood is keep on accumulating over in these regions. The blood is coming over here, the blood is coming over here. Okay, now this there will be accumulations of the too much blood. Actually, is under the normal physiological circumstances, we know that from the lungs the blood will come over here, but the extent of the blood that is getting deposited over because of the dysfunctional of the valve, okay, this region, so there will be too much accumulations of the blood. So further, what can we see? What type of the problem we can see over here? That during the mid diastole, whenever it will be in the relaxing conditions, during the mid diastole of it, the blood is, of course, the it is accumulating the blood during the, you can say, during mid diastole. During mid diastole, you can see this type of the problem, that one type of the abnormal heart flow, because there too much accumulations of the blood. So during the rapid ventricular filling is one type of the more problem, that is known as one type of the thing, that is what? That is the mid diastolic murmur. So number third I am showing you here. You can see the mid diastolic murmur. Mid diastolic murmur. Whatever the things I have described to this much, that was already based on the endocarditis. Now just see the things that the myocardium, it is getting anchored with valvular structures over here. Okay, so there is a chances for the antibodies to go over here, so that can cause the inflammations of the myocardium as well. So whatever the thing we can see, first thing we got over here the endocardium. Now if you see, let me just draw over here on top of the heart. For example, just like this. I'm not talking about the pericardium. Let's focus on the myocardium over here. Now let's suppose the endocardium. The endocardium is also covering these valvular structures over here. Okay, you see the structures over here. So this myocardium is getting anchored with the valvular structures over here. So there is a chances for the antibodies to go over this in this region. So as we can see, there will be here the different types of the antigens, antibodies. These things will come over here that can cause the further myocarditis, inflammations of the myocardium. So whenever the myocarditis will be here, this will be dilated. That will be severely dilated. So it's ultimately whatever the things here over here, the dilations of the myocardium. So dilations of myocardium we'll see over here. Dilations of the myocardium. As a result, we will see whenever it will be dilated. Okay, if you see the normal valvular structures, the valvular leaflet structures, that so just like this. Just like this. Okay. So during systole, whatever the thing, they will just go during relaxations. What? They will come over here. But if we see during the myocardial dilations, if you see the structure, that will be severely dilated also, that will be stretched out. Whenever it is stretching out, definitely the structures of the valve here, that will also stretch out. So the leaflets, they will go away from each other, just like this. You can see the structures. Now if we see during the dilation, the structures, just like this, they are going away from each other, the leaflets are going away from each other. So during the diastole, just to prevent the backflow, they may not be able to fuse just like this. Rather, they can go upward. They can go upward. So this is known as the yielding. You can see the yielding of the valves over here. Okay. So as a result, we will see what the center of the structures. We will see there is a chances for the blood to go from the ventricles to the outer. So you can see atrium. So you can see over here the mitral valve regurgitations as well. Mitral valve regurgitations over here. You can see further also. Okay. Now this type of the complications we can see. Now we'll talk a little bit about the structures that we see in case of the vegetations. So I already said you, these vegetations are found in case of what? The valvulitis. And this valvulitis is caused by what? The autoantibody reactions. Okay, that is for the beta hemolyticus, streptococcal Lancefield group A. Now these same types of the vegetations can also be found in case of what? Mitral valve stenosis. whatever the differences you can see over there. I'm trying to talk about that. Okay. Now, if I say in terms of just like these things, try to understand from over here. So I already said is the what anterior leaflet is the posterior leaflet. Okay, don't forget. Now let's suppose I'm writing here the valvulitis, rheumatic valvulitis, and I am just talking about here that the what mitral valve stenosis. Whatever the things or changes or the differentiations we see over here. Okay. First, let me tell you that in case of the rheumatic valvulitis, whatever you see the vegetations, that will be multiple and small. Okay. So the multiple and small vegetations. Multiple small vegetations will see over here. Okay. But in case of the mitral valve stenosis, here we are just not have the vegetations, but this vegetation just like this. It will be enlarged and irregular. Okay. Just like this thing. Irregular, enlarged. Okay. What about the second differentiations in between them? That in case of the, if we see the rheumatic valvulitis, in case of this, that these vegetations will get attached with the endocardium tightly. Okay. So tight attachment. We see the tight attachment of the vegetations with the endocardium. Okay, vegetations with what endocardium we can see over here. Endocardium. But if we talk about the mitral valve stenosis, there we will see the vegetation that will be loosely attached. We will see loose attachment. So we will see the loose attachment over here. Okay. What about the third thing? That if it is loosely attached, if we see in case of the mitral valve stenosis, if it is the vegetation is loosely attached, so there is a chances for it to get fell down from these regions, to get detached from this region, so it can just go away from these regions. So if the vegetation, if we see it is going away from these regions, so that can go to the different organs, especially if we talk about the CNS or central nervous systems, that can cause the metastatic abscess in the CNS. Metastatic abscess in CNS. Okay, I already said it's CNS here. Okay, because it is loosely attached. But in case of these things, we cannot see this type of the things over there. Okay, and if I see normally the drawing, we want to show you just like this. There are narrowing of the mitral valve. Okay, that's the normal thing. And yes, so let me just say once more again that I did talk. Actually, my main target was to say about the what systolic murmur and diastolic murmur and mid-diastolic murmur. Okay, what are the murmur you can see over here. Okay, and what type of the treatment and after management I am going to say in the next part of the subsequent parts of the video. Okay, and whatever the management you can see over here, and the last we will talk about the pericardium over here. Okay, whatever the changes we will see. So, if we see in terms of the pericardium here, okay, now let me talk about a little bit of the pericardial structures. Now, if I say in terms of the pericardiums, what are the, definitely there are some microcirculations. So a little bit of the microcirculation in the pericardium, that should be separate. Some circulation from the, definitely, if the, pericardium is, if we see also getting injured for the rheumatic, carditis, we can see a rheumatic heart disease, then we'll see within the circulations, definitely there will be endothelial cells within the pericardium. If you see the structures of the pericardium over here, whatever the changes we'll see, that's over the pericardium, and is the endothelial cell will relax within the pericardium, that is supplying the blood. Now, whatever the changes we'll see over here, we'll see a gap in between the pericardial cells. We'll see a gap. So there will be enlargement of the gap. So the gap that will be increased. Okay, in between the pericardial cells. sorry, in the endothelial cells. What I'm saying then before. Okay. So endothelial cells. Now whatever the problem we'll see that within these regions, whenever this type of the problem will be over here, the different types of the the different types of within the circulations, the different types of the protein molecules. For example, the albumin that will come over here. Okay, we can see the globulin. We can see also the fibrinogen that will come over here. Now the thing will be here from the both layer of the pericardium, fibrous and serous layer. Okay. Now within these structures, we see from the circulations, they will come over here and they will get deposited over here. Okay. So whatever the things we are seeing here, that have depositions or the accumulations of the different types of the proteins. Now this structure is just like this. If you consider the two braids over here, these are two braids for example, and in between there is a sandwich-like structures. So it is known as the bread butter appearance. So you can see here, in case of the pericarditis, bread butter appearance. It can be seen in these structures. So as a result, you can see over for the patient they will complain of the chest pain. Chest pain over here. That can be also the chest pain. So whatever the pericardial effusions we can see over here. Okay. Now, if we just see in terms of just normal structures, if we just consider just like these things that I already talked about the acute rheumatic fever or acute during the acute rheumatic heart disease. You can say acute rheumatic fever here. Now we'll talk about the chronic rheumatic fever. What are the changes we'll see over there? I'll just upload all these things in the subsequent part of the video. So what did I say you over here? Just try to understand here. Myocarditis, in terms of myocarditis, in terms of what endocarditis, what are the changes we are seeing and the differentiations between the rheumatoid, rheumatoid valvulitis, mitral valve stenosis over here, and what type of the problem we see over here in the pericarditis over here. Okay, and about the management and what are the steps we can take for the better management of the patients or the in case of the children. We'll talk about the next part of the videos. So if you're new, please do like and subscribe my channels to support me. I need your support of those guys. And if you have any problem to understand this topic, let me know in the comment sections. I'll try my level best to help you guys as much as I can. Okay, thanks for watching. See you in the next video.